On this episode of the Ask Mike Reinold Show, we talk about some of the ways we differentiate why somebody has lost mobility between muscle, soft tissue, and capsular joint play.
The Ask Mike Reinold Show. Helping people feel better, move better, and perform better.
Before we get to the podcast, I wanted to make sure you knew about my free online course on the Introduction to Performance Therapy and Training. If you want to learn how to get started optimizing and enhancing performance, this is the course for you. Head to MikeReinold.com/performance to sign up today. Welcome back, everybody, to the latest episode of the Ask Mike Reinold Show. We're up at Champion PT and Performance, Boston, Massachusetts. Dan Pope, Mike Scaduto, Dave Tilley, Lenny Macrina, answering all your questions. Dave, been a little fidgety today. What's going on, man?
I woke up at 1 this morning.
Why'd you wake up at 1?
Long story.
Long story? You didn't want to wake up at 1?
I woke up to go to the bathroom and I was very hungry and then I couldn't fall back asleep.
Interesting.
What'd you eat? Did you eat?
I did. I ate a lot. I had some nuts and I had some granola bar.
At 1 in the morning?
It's weird, man.
Okay, sounds like this could be a whole episode on this.
Send coffee quickly.
We don't want to go into it.
Yeah, no, all right, let's not go into that. I feel like we need to brighten the mood here. Mike, do you have any random
Trivia?
facts for us on this one? We put you on the
This
spot.
is really on the spot.
No
now.
humble brags about boating or whatever you're talking about.
Boating safety?
Yeah.
What about my daddy's boat?
Lenny, what do you have for him?
Oh, I'm so disappointed you didn't have anything. Len, who's our student today? Who do we have?
Our random fact of the day is we have a student named Trey Martin. Trey is from East
Trey Songz.
Tennessee State University. Trey, what is the mascot of East Tennessee State University?
The Bucks.
The Bucks. I
Bucks
love
like a
Bucks.
human buck or like a
Buccaneers.
Like Buccaneer.
The landlocked school in Tennessee is
Buccaneer.
Like
equated with the Pirates.
yeah.
Interesting.
I thought it was a deer.
Yeah.
No.
Are you sure?
Positive? Not completely sure now.
All right, Dr. Trey, do we have a question from somebody today?
We do. Mallory from Buffalo, New York.
Mallory from Buffalo is like our 16th question, I think. But you always have good questions, so we kind of keep taking them. Go Bills, right?
Go Bills.
Big Bills
Yeah,
fan.
big Bills fan.
Mallory, what's up, Mallory? Sorry, Dr. Trey, I got excited when I saw Mallory.
Hi guys.
Heard Mallory?
I have a difficult time deciphering between muscle tissue tightness / stiffness and capsule / joint stiffness. You discussed knowing the difference in hypermobile athletes, but can you be more specific on the approach you use to come to that conclusion? Are there specific tests, like a Thomas test, that you use? Go Bills.
Go Bills. I don't know about the Bills.
Bills Mafia?
Not to date it,
Dollar Bills.
not to date this episode, but there might be a matchup coming up soon between our New England Patriots and the Buffalo Bills.
It's gotta be terrible being in the same conference as the Patriots. It's gotta be terrible, but I like Josh Allen. I think Josh
I'm
Allen's
on my
got,
fantasy team. He's my second quarterback.
he's got some potential, but this is a good question, Mallory. I like this, and it's something we've definitely covered like in various components in the past a little bit. But like again, I think it's worth repeating and maybe going a little in depth on this a little bit. But really great question. Common question is, how do you know the difference between somebody that has a loss of mobility? Is it coming from the musculature being stiff or toned or tight or dense or whatever you want to call it, or is it coming from the joint in the capsule? Who wants to tackle this one? I'm looking this way. I figured. Pope, you got this.
Pope, get the shoulder.
Oh, boy.
I'll share on the hip.
Yeah, we could talk specifics about like each joint a little bit too, but yeah, let's talk in general first.
Yeah, so I do think, like everyone's saying, it's going to depend on the area you're assessing, right? The really easy assessment is just to joint glides, joint play for whatever area you want to take a look at. So let's say it's the cervical spine, right? You can take a look at lateral gliding each segment of the spine, and you can see if there's any global losses in joint play. And if you're checking someone's range of motion, let's say you're looking at flexion, extension, rotation, and you find that it's limited, and then you do your joint assessments, you can start to say, I don't know if this is a joint issue. You actually have a lot of joint play. Let's start looking at some of those muscles. So you can start doing some weird tests, like let's elevate your shoulders, and we'll try rotating, checking your range of motion, see if that helps, because now we're slacking some of the muscles, like levator, scap, and then the trap. And if you find that range of motion improves, okay, seems like it's more of a muscular problem, I probably want to treat those muscles, Same thing goes for the shoulder. You can take a look at joint play and see if it moves fine, and someone does seem a little hypermobile based on that, but they're still limited overhead. take a look at their lats, maybe put them on their back, flex your spine by bringing these to the chest, see if that changes their flexion range of motion. If it does, you can start to rule in the lats, right? So easy answer, look at the joints, and then if you're concerned that certain muscles are going to be players, then try to come up with a position that puts them in a stretch or shortened position and see if that changes the range of motion.
I like that. So I like how you changed the tension maybe on the muscles and then looked at the mobility again. I think that's something that sometimes people miss. I like that. What about like a sequence of all this, right? Because you jumped right into joint mobility on that. What do you guys think like about sequencing in here? What would you do first with somebody that you think? Would you go right to joint mobility, or are there other options?
Maybe start more general, something like a Beighton scale, and just see if they have signs of general hypermobility. It may help you kind of guide your assessment or your examination on them a little bit. If they're, what is it, out of 9 out of 9 on the Beighton scale, you may start thinking more hypermobility of the capsule, and then you can kind of guide your exam that way. But I'd probably look at just passive range of motion first. And see if they're restricted. Talking in the shoulder, we can stabilize the scapula and kind of see where they fall in terms of overhead elevation, and then you can do a joint play assessment after that. And if the joint is super loose, they're still limited overhead range motion. Maybe they have some underlying hypermobility that you discovered. Start thinking, okay, it's more lat. And then we can do some of the tests that Dan was talking about, changing tension on the muscle. Changing positioning, and that can help rule in muscle tightness.
I like that. So get a global snapshot of their potential laxity too. So looking at a Beighton scale, or maybe like a sulcus sign, or just looking at generalized laxity in general. That's a good point. Dave, what do you got?
Yeah, so I was going to kind of go off that, and I think something, it was harder to do that in the hip. So you guys have taught us like the capsular test versus the soft tissue test. They're pretty easy in the shoulder because the glenoid is so shallow.
That's a good
but
point.
in the hip, unfortunately, the acetabulum is real deep, and it's like you can't get any accurate joint glides. It's really not that good. So even with people that are dysplastic, and I've looked at some of this research because of the amount of like gymnasts and dancers that I treat, even if they have something called a crossover sign in a lateral center edge angle that's lower, which means the hip is really shallow, it's still not super accurate for gliding. So you have to kind of go off of the Beighton score. There was a paper in 2017, I forget the author, but they took like 50 patients and took their Beighton score, and then under anesthesia checked passive mobility of the hip, and that was significantly correlated to more laxity in the hip capsule. So I think it was over a 4 was the threshold, and over a 6 was like significantly correlated to more capsular hypermobility. So you can use those as a bit of more of an assessment, because I don't think you're going to get an accurate passive range of motion. You can't glide the hip, it's going to be harder. So that's just kind of where I've gone there, and it seemed to be pretty helpful to see, someone who has a lot of laxity. Is this muscle, is this soft tissue, what are you going to work on?
Yeah, and that makes sense for such a congruent joint like that you're going to see that on. So I guess I would say, like, if you notice somebody has a mobility limitation with like your passive range of motion, I think part of what you asked is like, is there a test we can do, like a Thomas test or anything like that, or do you have to look just at it? The problem with any of those other types of tests, like a Thomas test or even just some of like the active range of motion tests, is you don't understand like the real reason why they're having that issues. And what happens with the body is it's going to take the path of least resistance, right? So if you think the whole concept of relative stiffness, right? If you're trying to do a Thomas test and something is limiting the range of motion, something else usually helps to overcompensate to increase the range of motion. So those generalized tests don't do a good job of differentiating what's going on for us, right? So if somebody has a loss of active range of motion, right, and then still has a loss of passive range of motion, then we know it's a mobility issue and not just a motor control issue, right? So once they have that passive range of motion limitation, I think you go right to the joint, right? And you guys, again, kind of covering you guys with the joint, you go to the joint and see how much play the joint has. If that has a lot of play, then I think you can safely say this is probably not coming from the joint, it's more soft tissue. And then you go to some of the other things, like the positional things, where like, let's put some of the tissue on slack and see if range of motion is improved again. And I think that's like, you got to think of it like an algorithm. You know, so I think to answer your question is I don't think there's no one easy thing, right? You have to take a huge step back and understand, does this person have gross generalized laxity to begin with? And then two is you have to be able to look at the passive range of motion and then the joint mobility and figure out which one is part of it. And I think that's how you kind of put it together.
Yeah, I think that just really paying attention to end feel, especially when you're doing passive range of motion, can be helpful. In the shoulder, if it's more of a capsular end feel,
Squishy.
it just feels different, right? Than
Yeah.
like a different feel, like more of a muscular.
Yeah.
Leathery or squishy.
Shoulder's a great one to practice on too, because it's it's the most mobile. You can really move it around. When you get good at shoulder in terms of your joint plays and like assessing end feel, like Mike kind of said, like I think you'll get better at stuff like the knee that are a little bit more challenging to feel. I think you can still feel it in the knee, and then you go all the way to then like the hip, and then okay, that's an even bigger deal. It's so hard to feel. So I think there's a spectrum, and I think if you pay a lot of attention and practice this at the shoulder, I think that's like a good model to get better at this. So awesome, great question. Go Bills. Thanks, Mallory. Another good one. Mallory's probably which is probably like her third question. I think that's like a record on the show,
That's
right? That's percentage-wise, that's like 1%. That's pretty. It's pretty solid. We're almost that's like 2% almost. We're almost at 200 episodes. We're getting there. You're gonna have to have a big party, but anyway, if you have some awesome questions, even if you're not a Bills fan, you can head to MikeReinold.com, click on that podcast link, and fill out the form to ask us anything you want to talk about. But PT, fitness, sports performance, anything like that, we'll be happy to answer, and we will see you on another episode.